Mehdi Benchoufi. So here you are practitioners, you are head of clinic of the Hotel Dieu, and you are president of the Club Jade, 7 years. So you think about everything, innovation, digital. So before getting into the subject of medical and what kind of look you have on these subjects, what happened? How did the jury decide you get 50 projects? How do you pick the ones? Some projects come from Africa, some are in Africa, some have big budgets and others don't. So how did it all work out in your jury? Well, firstly, we had lots of fun, very, I would say, exciting because we had lots of projects with different medical, I would say, issues and questions. So it's a B2C, I would say, process. So different projects that have been submitted, and we wanted to select the key problems in public health, namely in Africa. And there was a big issue that was infantile mortality rate. So this is something that we discussed at length. And I would say what we wanted to do with the jury, of course we had lots of work, wonderful work by François Brix and Pierre, so we were able to kind of pre-filter some of the projects, so that saved us some time and energy, and then we focused on the essential. And maybe that made our whole approach original. Vision that is quite embedded, but also going in the field. Samir and his team did that. So it's not a bottom-up, but rather looking at how the initiatives come from the field. And so we can select with them. We've talked a lot about startups, budgets, investments, and so on. So what about the medical? Because we talk about health, healing people, health benefits. For the doctor, you are a doctor, you're a practitioner. Did you fill in a kind of checklist before selecting the candidates? Yes, well, first we clearly wanted to have a health benefit. So one priority was around maternal, infantile health, maternal mortality, and that was central. Of course, these are the key public health issues in Africa. For your information, over 7 million, in fact, children in Africa won't be able to survive above 7 years old. 1 out of 5 women won't survive delivery, which is enormous. I mean, these are all topics that definitely deserved our highlight. And another point, maybe it's won't follow the current trend, but at the same time we've selected a project related to diabetes, and you know that infectious and tropical diseases were the main cause of mortality in Africa. But today we see chronic diseases such as high blood pressure, diabetes, and they are becoming on the top priorities of public health because, of course, diabetes, you may think it is a disease of the richest. The rich, and so basically you were saying that we're exporting our diseases in the south? Yes, probably, because of the behaviors are changing, the habits are changing, and so there's more sugar in the food, so, and then we like sweets. And so today we see that there are key changes happening in Africa, and this is also an indicator, but it also shows what's going on in Africa. So to sum up, there was a key subject around maternal mortality, also around the trainings, or medical abuse, fraud. That was a big topic, but of course we're at the first steps of all that, but we're seeing these, so pharmacy, chronic diseases, mother-child. So let me ask you another question. In northern countries, we see lots of medical initiatives where we have doctors, practitioners developing things that they tested in the hospital. So here we are, in fact, really exploring the world of startups. So these are business. People want to commit, but they're not necessarily doctors, having initiated these projects. So is that of a disturbing point? You, as a doctor, seeing all these new players that are businesses. Well, in Europe, we have to follow by the rules. There's a time, place, and action. Of course, internet is changing things. So it wasn't only startups, and that was quite nice. Of course, we have entrepreneurs, but they're always a network in the field. So there's no state, really. The infrastructures, health infrastructures are really weak. But what I found very interesting is from the beginning, there's a network approach. From what is there, it could be very weak, but at the same time, it could be kind of a wealth. I think being agile is a key aspect. It's true, it's not necessarily in Western countries, we're not necessarily used to that. So not necessarily in our habits. So we've had several speakers this morning talked about innovation. Innovation is in the southern countries because they don't have as many constraints, and maybe they can be quicker and bolder than us. So fewer constraints, less regulatory constraints, so they can develop more easily. So what is your opinion as a doctor? Because if in Europe, or if in Western Europe, we have cohorts, you have trials, you test people, you test, there are some protocols, there are some regulations. So it's nice to go and maybe test these same things in other countries where there's no constraints and then get the outcomes. So what do you think of that? Well, it's true, innovation is in Africa. Today, innovation is global. It's not just in one country. What's very new is that in Africa, innovation is at the starting point. So it's not just the area of health, but also innovation in Europe. So we can talk about a migration movement from south to north, and this is in some of the awards that we've selected, these candidates, they talked about bio-vaccination. So very basic, very simple, doesn't exist in France, and we can see that in my clinical practice, we see some vaccine booklets. The adults didn't follow their vaccination dates, so we found that in Africa they did this very smartly. And there's also what we call collecting data, clinical trials. We're in a bit of a kind of a simple lab. I think that everything has to be framed from a methodological point of view. So the idea is not to have, I would say, too many infrastructures or institutions, but at the same time we have to, of course, be careful about the security of patients, and just deploying clinical trials without any control, I think that it's harmful to the population. So yes, on the one hand, there's this opportunity of going towards innovation very quickly, very boldly, but at the same time, it could be quite risky. And what's interesting, in Nigeria, you see some groups, clinical research, they in fact work on methodology on clinical trials, and now they're rolling out on a lot of countries, mainly northern countries. We see it in Asia, we see it also in Africa. So you remember in the past, Africa was what we call international medicine. So they see and they find that there is a need to create a framework for clinical trials. Two last quick questions. We see in all the projects that have that will be presented, is when they invent or they think about an e-medicine, e-health solution, there's always education backed up to it. So even if it's very technical, there's not always indication. But their education is always there. Shouldn't that be quite interesting for us? Yes, well, we see that there's a similar pattern, not only, well, linked to technologies, what we call preventative medicine. And I think that the best way of treating a disease is making sure it never happens. But we see that in our projects, in our initiatives, the idea that by informing patients, by addressing and giving advice, posing a diagnosis, it's simple treatment, and that is very positive on the patients, especially during pregnancy. So lots of education, from medication, from treatments, and other question. I know that you're always interested in this ability in southern countries to work quite easily between hospitals, doctors, companies, startups, project holders. We find that the links are easier. True, very flowing, very easy, either because there's internet or mobile phones, so very natural, they're very much embedded, and this is a great way of inspiring ourselves. And so this kind of meshing vision, associating the various classic entities, but not only various networks in the field, maybe not so much in the health, but anyhow, there is a kind of mover and shaker, and this is so the do-it-yourself. Yes, it's true. We had to explain it what it was in Europe, but there, it's easy. Everybody understands what it is. I think they're all, I would say, ready for it. Thank you very much. In Africa, we had to, well, it's nice to talk about do-it-yourself. Well, because here, there's a network. Okay, one last question. As a doctor, what do you expect from this day, from this first meeting on Pierre Fabre Observatory? Well, hopefully, I think everybody will notice all the initiatives, very relevant from a medical point of view, and also really inspire yourselves what is done elsewhere, not necessarily copy and paste it, but maybe change our attitudes. I am in charge of a project called EcoPan. In fact, there's a kind of ultrasound, a miniature ultrasound, in order to have a diagnosis. So the fact of, I would say, seeing what's going on elsewhere, it's a great way also of projecting ourselves and seeing what we can do in the future years. Yes, try to feel the nice ideas and again migrate them in your country. Thank you.